Hi and welcome back. My name is Monica. Today we're going to be doing another Explant Q&A, but focused more on healing and recovery. I think there's going to be more and more people looking at this information and wanting to know other people's experiences, so I want to be as helpful as I can. Let's get into it. Before I get started, just wanted to mention that I have a dedicated video on how I chose my surgeon, as well as all the reasons I chose to remove my breast implants. So if you want to check those out, those are pretty recent. Okay, so the first question is, what type of removal did you get done? So I got an en bloc capsulectomy, which is where the surgeon attempts to remove the capsule and the implant at one time in one piece. And that is an attempt to protect your body from any sort of further contamination should your implants be ruptured or anything like that. Which leads me into my next question, which is, did you remove the capsules? This I get asked so frequently, and I think it's because there's a lot of differing opinions from surgeons on whether to leave them in or take them out. The capsules are the scar tissue that forms around the implant. It's your body's immune response trying to protect you from the foreign object. In my opinion, I don't know why anyone would want to leave them in. I feel like it's part of the surgery. It's pretty much part of the implant at this point, and I wouldn't want to leave something in my body that was potentially holding toxins. So in my opinion, I wouldn't do it any other way than getting as much as possible of the capsule out of your body. I have heard of many instances where women leave the capsule in and they have to go back later down the line to get another surgery to remove the capsules because they're having complications with it, or they haven't healed properly, or they were still experiencing breast implant illness symptoms. So I think if you're going to do it all the way so that you can just heal and move on from it. Which leads me to my third question, which is, did the surgeon send the capsules to Pathology? Yes, I made sure I chose a surgeon that was going to send the capsules to Pathology. Pathology basically tests the capsules for toxins, heavy metals, anything hazardous, which is another reason why I believe you should remove the capsules, because why would you leave something in that surgeons are sending to Pathology to get tested? And if they're left in your body, there's no way to get them tested. My pathology report came back clear, thankfully, but I have seen pathology reports in the Facebook groups that I'm in, and they have came back detecting all sorts of things. Okay, did you get a lift? Why or why not? So no, I did not get a lift for many reasons. One being that I really just didn't care how they were gonna look. I just really wanted them out of my body. I truly just trusted my body to bounce back. The body can do amazing things, and I just had so much faith and wanted to see how my body would heal. My surgeon also said that I had a good amount of breast tissue naturally, so that I would probably be fine, which was of course nice to have that reassurance. It's also another procedure on top of what you're already doing, and explants are complex surgeries. So it's extra recovery time, extra work done on your body, and it's also an additional cost. It could double it. The body can do amazing things, and I just went with my gut. Okay, the next question is, how did they look right after surgery? So when I got home from surgery and I was laying down, I took a peek and I was kind of alarmed because I had indents on both sides. It's kind of hard to explain. I have a pinned TikTok showing it and talking more about it, but it's basically an indent made by where your fold naturally was compared to where the implant pushed your fold out to. It's hard to explain, but it's very common. So that kind of made them look a little deflated, but other than that, they really didn't look that bad. They just looked a little weird. The next question is, did you have a fluffing period? So by fluffing period, they mean the breasts kind of fluff up, they take shape more, they kind of fill in a little bit, and mine definitely did that. I watched the indents go from pretty prominent to non-existent. It took around 3 to 4 months for them to look normal again, but keep in mind there are women who say they never went through a fluffing period, so there's really no guarantee that your breasts are going to look a certain way or they're going to fluff up. Everyone's body is just different. Did you do anything to help the skin bounce back? So no, I really didn't do anything. I just let them heal. I stopped looking at them every day, and I would just take pictures like once a week to kind of look at the progress, because if you stare at them every day, you're not really going to see a difference. Some people say massaging, some people say cupping. I didn't do any of that. I just let them heal. The only thing I did was continue to wear my tight sports bras and bralettes all day. Did you do anything to detox? Some people are really big on detoxing. I'm not one of those people. I believe that if you give your body the right tools, your body detoxes naturally on its own. I just continued to do the things that I knew helped my body be at its best. So eating mostly whole foods, drinking lots of lemon water, staying active, staying away from toxins like perfume, plug-ins, stuff like that, like bleach, anything like that I stay away from. Those are just some of the things that you can do to make sure your body's allowing itself to detox. Some things that I do now are dry brushing, and that is for lymphatic drainage. It helps to detox your body, but everybody's different and you just have to do what works for you. Okay, next question, did I have drains? So yes, I had drains. I had never had drains before in my life, and let me tell you, they were very uncomfortable. It was such a weird feeling to have something just sticking out of your sides. It was just super clunky and annoying to have these tubes hanging down all the time. The drains were honestly the worst part of my entire surgery. So the drains would fill up with fluid and you would have to empty them every couple of hours and record how much fluid was in there just to track your progress. I had drains for 10 days and I was so excited to get them removed, and the drains hurt so bad to get removed. This is not the case for everyone. Some people said they couldn't even feel their drains coming out, but for me, this was the worst part of the entire surgery. It hurt so bad I almost passed out. That leads me to my next question, which is how bad was the pain after surgery? I have to say, I don't really feel like it was painful. I feel like it was more discomfort and soreness. I didn't take any of the prescribed pain medicine. I didn't take any Tylenol or anything like that. I literally just wrote it out and it was totally fine. Like I said, it was more just the discomfort and soreness. Also, you get really stiff from not moving a lot, so it kind of makes it a little worse. But honestly, I was in much more pain when I first got them in. How long was recovery? So I was out of work for 2 weeks. I got my drains out on the 10th day, and then I went back to work the following Monday after that. I had someone with me at all times for the first 3 to 4 days because the surgery really does mess with your core function, so it gets really hard to move around and to get up from laying down to go to the bathroom and whatnot, so you really can't do much. After the first couple of days, I kind of just laid in bed and rested, and I didn't have to have anybody with me. Like I said, I went back to work after 2 weeks, but I was at an office job, so I wasn't doing any like heavy lifting or running around a lot. Even after 2 weeks, I was still very tired. I was getting out of breath very easily, and I was still very sore, which leads me into my next question, which was, did you get muscle repair? Yes, I did get muscle repair. So what muscle repair is if you have your implant under the muscle, they have to lift up the muscle, take the implant out, and then they kind of have to pin the muscle back down. And because that is more work in your chest area, you're gonna be sore for a longer amount of time. I was sore for about, I want to say like 6 to 8 months. In my opinion, muscle repair should be part of the surgery. And you don't want to have further complications down the line because they didn't do muscle repair. Okay, last couple of questions. How do they look now compared to before you got implants? So they look generally the same as before I got implants, but they are bigger and they like hang more, if that makes sense, which I'm sure would have happened with time and body changes anyways. It could also be from the skin being stretched out from having implants for 8 years, but they look really similar to what I had beforehand, just bigger. Are you happy and do you regret anything? No, I am literally so happy with the way that they look. I'm so happy with the way that everything turned out. The only thing that I regret is not getting them out sooner or just not getting them in at all. It was such just a waste of money and time and effort and sacrificing your health and well-being. It's just so not worth it, and I just regret getting them in the first place. I mean, it was definitely a learning experience. I learned a lot about myself, but I would have been better off just not getting them at all. But yeah, I'm so happy with the way everything turned out and so grateful I was able to get the surgery. I love the way they look now more than when I had implants. So much more confident now, much more happy. I love it. The last thing I want to talk about is how my health issues have changed since Explant. So one of the biggest changes is that a few weeks after surgery, when I really started to heal and feel better, I finally was able to take a full deep breath again. I, for many years, felt like I couldn't take a full deep breath, and like every time I tried to inhale, it would just constrict and it would just stop, and I could never take a really, really good deep breath. I remember laying in bed and going to take a deep breath, and my eyes started tearing up when I realized that my breathing was different, and I was like, oh, that's a deep breath. Like that's a real deep breath. So that was probably the biggest thing for me, because not being able to take a deep breath doesn't feel good, and it really added to my anxiety, which my anxiety and depression were horrible and the worst it has ever been in the years that I had breast implants. It's a very common symptom. I would have depressive episodes probably like every few days, once or twice a week, and it really affected my life. Now I rarely feel feelings of depression. I think everyone always has a level of anxiety, but it's just so different now, and I've even been able to wean myself to a lower dose of medication. I also always had this feeling of pressure on my chest. I always felt like there was somebody just stepping on my chest, and that also went away as well a few weeks after surgery. I stopped getting so many tension headaches. I stopped having sharp breast pains. I also ended up losing around 10 pounds after surgery. It didn't happen right away. It started probably like 3 or 4 months after surgery when I was really healing and recovering. Right around that time, I started slowly shedding extra weight, and I lost around 10 pounds and just have been the same weight ever since. So I can only guess that it was correlated. Maybe it was inflammation. I don't know, but I did end up losing around 10 pounds after surgery. This is also common, but I noticed that my facial features came back. I was looking at a picture from right before I had my explant and a picture from a few weeks ago, and I couldn't help but notice the difference in my face. I just looked totally different. It literally looked like my facial features came back, like my face came back to life. I've seen it so many times. People's face look brighter, their eyes look wider. It's just crazy the things that can change when you remove these toxins from your body. Overall, I just feel so much lighter, so much clearer. It's so nice to be in the body that you were given, the body that you were meant to be in. I know this isn't the case for everybody, but I was so excited to get my implants out. I just could not wait for them to be out of my body. I'm such a lighter, happier version of myself, and so much more confident than I was before implants and with implants. So that is it for this video. I hope it was helpful. As always, if you have any other questions, comment them down below. I will continue to make these types of videos. Thank you guys so much for watching. Don't forget to subscribe to my channel and give this video a thumbs up, and I will see you guys in my next video.